Welcome to week 2 of understanding and improving the U.S. healthcare system. When we talked in week 1 about the 4 main players as patients, providers, payers, and public health, we set a helpful groundwork for understanding why U.S. presidents would try to improve our healthcare system when those elements of the healthcare system weren't working well together. In particular, what has been a common theme of presidential healthcare reform in the U.S. has been trying to add and expand coverage for individuals to help them pay for the health care they're seeking. With so much news around the Affordable Care Act right now, it's easy to forget that the federal government did not always have such a big role in our U.S. healthcare system. In fact, some of the first and largest discussions at the national level about how much role the federal government should have began with the administration of President Harry Truman. In the mini documentary I'm about to show you, we take a look at the role of President Harry Truman, President John F. Kennedy, and President Lyndon Johnson as they made the first efforts to expand coverage in the United States. While President Franklin Roosevelt had been supportive of national health care as part of the New Deal, he was unable to address the issue because he was preoccupied with the challenges of the Great Depression and World War II. Upon President Roosevelt's death, Vice President Truman assumed the presidency, thrusting him into the management of a post-World War II America. As the war ended, President Truman announced an aggressive conversion program designed to shift the American economy from wartime to peacetime. As part of these initiatives, Truman promised a national health program. Later that year, he rolled out a 5-point plan to reform the U.S. healthcare system, including provisions for new hospital construction, expansion of medical education, and national health insurance. President Truman was committed to passage of national health insurance despite heavy opposition from the American Medical Association and later from a Republican-controlled Congress. During his 1948 presidential campaign, Truman often pointed out his efforts, thwarted by Congress, to establish a national health insurance program, highlighting aspects of our healthcare system that are still challenges 65 years later.
Then I asked this Congress to do something about the health of the people in this country. I asked them for health insurance. I asked them for hospitals. You know, in this country, there are 2 classes of people that get all the medical care that they ought to have. And that's the fellow who's got $1 million at this end of the scale and the fellow who hasn't got a cent at this end. But the people in the middle, the big, large number of people in the middle between those 2 classes, can't afford to go to a hospital, and they can't afford to pay what it costs sometimes, and they can't afford sometimes even to pay the doctor bill after they get service. And I wanted an insurance program that would work so that the fellow would have a little money saved up when it came time to pay medical and hospital bills, and the doctor and the hospital would get paid promptly. But the Republicans are against that. They say that's socialized medicine. Well, it isn't.
President Truman's quest for healthcare reform was shaped by his belief that healthcare was a basic right, a pillar of the New Deal and a cornerstone of America's Fair Deal. Despite his inability to enact national health insurance, President Truman set the tone and shaped the modern healthcare debate that continues today. With prosperity flowing in the 1950s, private insurance took a more prominent role as a payer in the U.S. healthcare system. This expansion and coverage brought with it a new challenge: the high cost and risk of insuring America's seniors. In his 1960 campaign for president, then Senator John F. Kennedy highlighted this issue and later carried it with him into the White House. During his first year in office, President Kennedy's popularity soared, with key administration officials acknowledging that health care for America's seniors was a politically advantageous issue to address. Kennedy embarked on a national campaign to promote the passage of Medicare, a program to provide government-supported health insurance to the elderly. He rolled out his proposal in his 1962 State of the Union address and carried his message through a series of high-profile public appearances.
No piece of unfinished business is more important or more urgent than the enactment under the Social Security system of health insurance for the aged. For our older citizens have longer and more frequent illnesses, higher hospital and medical bills, and too little income to pay for them. Private health insurance helps some, but its cost is high and its coverage limited. Public welfare cannot help those too proud to seek relief, but hard-pressed to pay their own bills. Nor can their children or grandchildren always sacrifice their own health and family budgets to meet this constant drain. Social Security has long helped to meet the hardships of retirement, death, and disability. I now urge that its coverage be extended without further delay to provide health insurance for the elderly.
These appearances also included an historic televised campaign speech at a rally of America's seniors, in which Kennedy appealed to all Americans to urge Congress to pass Medicare legislation.
We've got great unfinished business in this country. And while this bill does not solve our problems in this area, I do not believe it is a valid argument to say this bill isn't going to do the job. It will not. But it will do part of it. Our housing bill last year for the elderly, that won't do the job, but it will begin. When we retrain workers, that won't take care of unemployment chronically in some areas, but it's a start. We aren't able overnight to solve all the problems that this country faces. But is that any good reason why we should say, let's not even try? That's what we're going to do today. We are trying. We are trying.
Despite President Kennedy's passionate appeal, he was met with strong opposition from the American Medical Association and a skeptical Congress. It was only 1 year before that the AMA had contracted a Hollywood actor by the name of Ronald Reagan to produce a recording discussing the dangers of socialized medicine.
What can we do about this? Well, you and I can do a great deal. We can write to our congressmen, to our senators. We can say right now that we want no further encroachment on these individual liberties and freedoms. And at the moment, the key issue is we do not want socialized medicine.
President Kennedy further argued that Medicare was a logical extension of Social Security that already had general popular support. In opposition to Kennedy, Congressman Wilbur Mills, chairman of the House Ways and Means Committee, blocked the legislation. After much maneuvering, Medicare was defeated later that year. On November 22, 1963, Kennedy advisors met to draft a memo putting forward a plan to resuscitate the Medicare debate. But the responsibility would shift to President Johnson, as President Kennedy would not live to lead the next debate over Medicare. With Lyndon Johnson assuming the presidency, the debate over Medicare was reignited. As part of his 1964 re-election campaign, President Johnson continued President Kennedy's work on the passage of a medical assistance bill for America's seniors. Johnson campaigned tirelessly for the bill's passage, working with both liberals and conservatives to ensure that it would not be defeated. As part of his 1964 poverty tour, President Johnson heard many stories from Americans who expressed the urgency for the passage of this bill.
We must unite in passing a bill in Congress to help our older citizens secure decent medical aid under Social Security. Inadequate hospital care is an indecent penalty to place on old age. In the hills of eastern Kentucky, one of the 13 states that I visited in the last 13 days in the program to meet the people and to know the country and to do something about the problems. In that program, I sat next to a father that had 11 children, that had worked 4 days last month, that had made $4 a day, and had had to feed those little hungry mouths largely from surplus commodities. And he told me, because he believed in the admonition of love thy neighbor as thyself, that he had been over and sat up with an 85-year-old man until 4 o'clock the night before the president visited him. Why? Because there was no hospital for him to go to, and there were no resources to pay the hospital bill. Situation like that must end in America.
President Johnson, a renowned legislative negotiator from his days in Congress, formed a strategic alliance with Wilbur Mills. Mills, still chairman of the House Ways and Means Committee, had 2 years before been responsible for the defeat of the bill President Kennedy had introduced. On the campaign trail, Johnson was passionate about the pressing need for this bill's passage.
Nearly half the aged couples in this country have incomes of less than $200 a month. Half those living alone have incomes of less than $80 per month. The old get sick more often, and the old stay in the hospital twice as long. When sickness strikes, it wipes out their savings that they've carefully put away over a lifetime in an attempt to ease the twilight days. It often goes untreated and uncared for. What can a nation say to these people? Can it say, yes, you have given a lifetime of toil. You have helped make America great. You have produced the sons that won our wars. But we no longer need you, and your troubles are your own concern. Well, that is not the answer the Johnson administration is going to give those people. We are going to fight for medical care for the aged as long as we have breath in our body until it's passed.
With the support of Democrats and Republicans, President Johnson was able to get his bill passed and signed into law in July of 1965, establishing Medicare and Medicaid. At the bill's signing ceremony, Johnson honored the pioneering healthcare reform efforts of former President Truman, presenting him with the first Medicare card. During his remarks, President Johnson reiterated his compassion for the healthcare needs of the elderly.
There are more than 18 million Americans over the age of 65. Most of them have low income. Most of them are threatened by illness and medical expenses that they cannot afford. And through this new law, Mr. President, every citizen will be able in his productive years when he's earning to insure himself against the ravages of illness in his old age. This insurance will help pay for care in hospitals, in skilled nursing homes, or in the home. And under a separate plan, it will help meet the fees of the doctors.